Welcome to this See Jason podcast. This is Rob Ellis here from the University of Queensland and Princess Alexandra Hospital in Brisbane, Australia. On behalf of my co-authors, I will be discussing our paper entitled End-Stage Kidney Disease Following Surgical Management of Kidney Cancer, which was published in See Jason. In the developed world, the kidney is the 6th most common site of cancer in men and 13th most common site of cancer for women, and in the United States, kidney cancers constitute approximately 4% of all newly diagnosed cancers. The most common management approach for kidney cancer is radical nephrectomy, which entails surgical removal of the cancer-affected kidney. Although the ability of the kidney to compensate for reductions in nephron number is quite robust, it is likely that removal of all or part of the kidney is associated with a higher risk of kidney failure, particularly for patients who have pre-existing chronic kidney disease. Our study aims to evaluate the burden of kidney failure following nephrectomy in the Australian state of Queensland and to identify potential risk factors for this outcome. Using the Queensland Cancer Registry, we identified all 2,739 adults in Queensland who were newly diagnosed with unilateral kidney cancer between January 2009 and December 2014, and who were managed surgically with either radical or partial nephrectomy. Overall, 68 out of 2,739 patients developed ESKD, with a median follow-up of 59.4 months. The incidence rate per 1,000 person years was 5.2 for radical nephrectomy and 3.7 for partial nephrectomy, which translated to approximately 1 in 53 patients managed with radical nephrectomy and 1 in 100 patients managed with partial nephrectomy developing ESKD within 3 post-operative years. Our analysis showed that, apart from having moderate to severe kidney disease before surgery, or undergoing subsequent nephrectomy after the procedure, older age, male sex, the presence of diabetes mellitus, socioeconomic disadvantage, and a higher American Society of Anesthesiologists score were all associated with the development of ESKD. Our results suggest that incidence of ESKD in patients managed surgically for kidney cancer is not insignificant, and the factors associated with ESKD after nephrectomy were reasonably contiguous with recognized risk factors for chronic kidney disease and ESKD in the general population.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.